unfortunately, sometimes when people talk of rugby, there are some people who think of it, negatively just because of the nature of the sport and how the sport is played.
It's a sport of gentlemen. We tackle below the waist. You make sure you listen to the referee. It's a sport where you're taught resilience, you're taught, understanding hard work and all that.
Menstrual hygiene is a basic human right.
There's no story without numbers.
Youth economic empowerment is one of the foundations of sustainable change. Let's talk.
Let's talk. Let's talk.
One-to-one cafe. Hello and welcome to another episode of One-to-One Cafe. With me, we have a special guest atajiintroduce. Wakenya tutamuita Pius ama Pius ama tatuambia what his name is. This is one of our partners that we have partnered with at LVCT Health through the One-to-One Youth Program, and we're very excited to have him here. So, Pius, salimia Wakenya.
Hi. Thanks, Michelle, for having me. My name is Pius, or as Michelle has said, Pius, whichever matamshi. As it comes out, the it comes out. I'm fine as long as it's one of those two. So Pius Shundu. I work for a company known as DBA Africa, and we have formed a partnership with LVCT Health and One-to-One, and I'm pleased to be here.
Asante sana. Today we're just going to do a quick introduction as to who DBA is, DBA Africa, and the strides that we're trying to do when it comes to supporting our adolescents and young people and the Kenyan public in general. So, Pius, please let me know or tell the people, who is DBA Africa? What do you do? Why do you do it? Who do you target?
So, in summary, I can say DBA Africa is an East Africa-based NGO that uses the power of sport to educate, empower, and unlock opportunities for youth. Mm-hmm. So basically how we started out was as a sports agency, because we all know how much talent there is in sports in Kenya. Mm-hmm. And we felt that a lot of the talent in Kenya was undervalued or underrepresented. So we began representing these athletes, but the opportunities for them to excel financially were not there in the corporate space. So we decided to go back to the drawing book, and we targeted now the grassroots of sport. So this makes us do a lot of work in sport for development. So as we went along, we found that education is the biggest niche that if you couple with sport, somebody can succeed a lot easier. Yeah. So we use sport as a grassroots or as a caveat towards education. Mm-hmm. And basically our target is anybody who is gifted in sport, anybody who thinks they are gifted in sport, or anybody who thinks they could have an opportunity to better their life through sport. Mm-hmm. That's who we're targeting. So that could be parents, teachers, athletes, everything. Mm-hmm. Yeah.
All under the spectrum.
All under the spectrum of sport, yeah.
Mm-hmm. Yes. That's great because Kenya, is known world over for athleticism and all that. And it's so funny that you'd say who think that they're good at sport. Mm-hmm. So everybody and anybody can come and you will try and nurture that. If it's not there, what do they do?
You see, that's the great thing about sport, because we all think about sport as somebody who's doing an action in the sports field and succeeding, and that's the person who's making money from the sport. Mm-hmm. But there's a wider array. Like if you talk about, let's say, football or rugby or those team sports, for example, they're the two teams playing against each other. Mm-hmm. But there's also the referees, there's analysts behind the scenes, there's sports psychologists who are coming to the fore now, there's food nutritionists. Mm-hmm. So the whole body of sport needs a lot more work in Kenya. And that's what we're trying to do. Like if you can use sports to educate somebody to be a sports psychologist and they were good in volleyball, they can help their team and move forward. Mm-hmm. If somebody is fighting sexual and reproductive health rights, they can use that to teach about rugby. They can use rugby to teach about the rights and all that as well. Yeah.
Okay, well, that's very interesting because most of the time, I think when we're talking about sports, we just think of the athlete or the person doing the sport, but there's a whole outside of it, and it's great to see organizations that are actually in Kenya that are doing it, because for a very long time I wouldn't have thought that we have that kind of expertise or even interest in having that. So thank you very much for the work that you do. So as I mentioned before, DBA Africa and LVCT Health partnered, and as he's mentioned, DBA Africa is a sports for Development organization. Well, LVCT Health, as the name suggests, is a health organization. So could you tell us just a little bit more about why we partnered and what we're hoping to do with our partnership?
That's an interesting question with a long answer, but I'll try and summarize it, obviously. Yeah, so we did a couple of needs assessments and surveys around sport. This is around E10, around rugby players in Western Kenya, around people who are doing athletics all over the country. And we found there's a stark reality whereby there's a lot of gender-based violence being perpetuated against sports people, and that it's also like very silent, but well known. So it's like a silent secret. So that some specific examples are where female athletes can win winnings for a marathon, but the money is not paid to them directly, but it's paid to either their spouse or their coach because they weren't registered in the right way. And that's something as simple as education. Yeah. Something even simpler like somebody is being beaten at home for something that they did not do or that's not their fault. And they keep it secret, but they share it with their friends in the rugby circles. So we found that people, first of all, have things that they're going through and are not able to speak about it, and they can't find solutions to it on their own. So we started looking for like-minded organizations who can maybe teach about gender-based violence prevention, maybe teach people about mental health and mental health skills and how to deal with problems perhaps and how to seek help. And then we came across, obviously, LVCT Health and all the work that you had done. Long story short, along the line, we've taken our time actually and developed a program that we think would work very well in terms of the niche that we both have in terms of health education and in sports for development, whereby we target the grassroots and we target people at the grassroots where we're teaching them sports, resilience and all that. And at the same time, mental health and mental health skills.
Yeah, it was a very interesting partnership where we bring both together because we also recognize that sports is such a great medium. I mean, Kenyans love sports in all its entirety, in different types of sports. And it's a great medium to be able to get to different communities using sports and then adding the element of health education. So we're very excited about our partnership. At least we've had some progress. We have capacity built some coaches from DBA Africa to be able to capacity build them in terms of safeguarding, and this safeguarding includes safeguarding themselves. Sometimes we talk of safeguarding, we think of kids, but we also need to think about adults. So it's safeguarding the whole community, so to speak, because nobody lives in isolation. So we're very excited about this partnership and seeing how far it can go along. So stay tuned for more information on how this is going to go. So I don't know if you have any parting shots. Kuna maneno matamu unataka kuachia?
Maneno matamu. Should we perhaps introduce the intervention that we've come up with?
Yes, please.
So I think the name of the intervention we've come up with one-to-one youth is called Tackle It. And it's a sports-based intervention. And obviously, as the name says, Tackle It, you're thinking, rugby immediately. Yeah. So it's a rugby-based intervention to try and target gender-based violence, which we're going to try and run in schools and in the communities, whereby we'll target, as we've seen in sports outside now in Kenya, we've seen a lot of rise in the rugby team, which has been up for a while, but then faced a downfall and then came up. And surprisingly, if we're looking at the male rugby team, the Kenya Shujaa, both in 7s and 15s, they've been on the rise for a long time. But in the last couple of months, we've seen the female team has also jumped up to the fore. And they also are talking about the same problems that I said in our risk assessment. So we're targeting rugby as pipeline to get them started. That a lot of children, when they start playing rugby, they start playing rugby when they're 18, 17. So we want to start targeting them when they're younger. And at the same time, try to target the norms that they're taught that are inappropriate, like in terms of GBV, in terms of violence prevention, in terms of mental health. Target that also from a young age. So mental health and rugby-based intervention in schools. And that's what we're trying to do now.
And it's such a good one because, unfortunately, sometimes when people talk of rugby, there are some people who think of it, negatively just because of the nature of the sport and how the sport is played. So I think it's such a great way or a great opportunity for us to even try and dispel that myth, especially among maybe rural or semi-informal settlements where they may think or not understand the sport and just
Mundo strong.
that one, So, yeah.
And that's a lot of what we're trying to combat, especially why we paired gender-based violence and rugby, because everyone thinks, rugby is a violent sport, but it's a sport of gentlemen. Like we tackle below the waist. You make sure you listen to the referee. It's a sport where you're taught resilience, you're taught, understanding hard work and all that. And on the same side, you're taught to be macho in a sense of the form of the word. So you won't seek help, when you won't speak out more or less if it's somebody against you. And that's not what we're trying to combat on the other side, because we can only make society better as a group, So if one of us is going down, we must do the teamwork to pull them up, and educate them in the way that society should be.
Yeah. I think this is a very, very interesting intervention. We have big dreams and hopes for it, and we look forward to, piloting it and taking it even further and seeing the impact and the change that it will make in Kenya. So, do you have anything else that you'd like to say?
Yes, I think in podcast or interview terms, we might be here for part 2 as we continue doing this work. So we're trying to look for more funding for Tackle It so we can go into more schools, reach more children, educate more people. So my parting shot would be look out for more news from DBA Africa, look out for more news from One-to-One, and we'll teach you more about what we need, what we want, but we would require your help. So look out on our socials, and you can reach out to us as well.
Yes, you can get DBA Africa at DBA Africa on all platforms. And you can also follow us. Why are you not following us? Please follow us on Facebook, Instagram, TikTok, and Twitter, X, and YouTube as well, where I suppose you're going to be watching this. And I think we will see you next time. Your host has been Michelle. See you. Bye.